Hello, we are the intensive support team, and today we are going to be talking about our phlebotomy pathway. The intensive support team, also known as IST, work within Services for People Who Have a Learning Disability, SPLD. We are a crisis team who support adults with a learning disability in Bedfordshire. We recognise that sometimes people with a learning disability struggle to have their blood test. This could be for a number of reasons. For example, being fearful of needles, involuntary movements, or not knowing what the procedure involves. However, it is very important for people with a learning disability to have a blood test to ensure that their physical health needs are met. Therefore, in IST, we have a specific phlebotomy pathway to support people with a learning disability with their blood test.
So the criteria. Referral is made into SPLD. SPLD then screen and the MDT decide who is best placed to carry out the blood test. If it has been decided that IST is the most suitable, then the following criteria must be met. The person should have a diagnosis of a learning disability and be an adult. If a person is autistic, they will also need a diagnosis of a learning disability. They have to be resident within Bedfordshire or have a GP in Bedfordshire. The person should have had an attempt of a blood test from the GP. If unable to, then the community phlebotomist. Only once both avenues have been tried and unsuccessful, then a referral to SPLD for phlebotomy be made.
Before the referral is made, the person's capacity would have to be assessed by the referrer. The person must be formally assessed to lack mental capacity to make the decision around the blood test and understand the reason for the blood test. Individuals, including the person's family or an independent mental capacity advocate, may be involved in the best interest meeting. All parties must agree that the blood test is in the person's best interest, even if clinical holds are needed. A referral then is made to IST with the relevant information and details. The referral will be reviewed, and if deemed appropriate, the person will be added onto the IST phlebotomy waiting list, and then they will be contacted to arrange the blood test. Once obtained, the samples will be taken to the pathology lab. The results will not be sent back to IST, but be sent back to the person who made the request for the blood test, who is usually the person's GP.
I'm going to talk a little bit about the clinical holds that IST are trained to use when carrying out a blood test. To ensure the safety of all parties, it will be appropriate for IST to hold the person in order to minimise the movement of their limbs, to maintain their safety, and to ensure an efficient blood test can be carried out. IST will ensure the time of holding will be minimal, reasonable, and proportionate. For some people, the use of PRM medication prior to the blood test is required to make the person feel calmer and to minimise the use of holds. We will now demonstrate a blood test and the holds that we use in IST. A clinical hold would be used only if the person lacks mental capacity, as discussed previously. IST would use a hold that looks like this in order to take a person's blood. If we needed to take the blood from the back of the hand, we would adjust our holds as so. If the person became more resistant, we would need to adjust our holds into a more secure hold that would look like this.